Hey guys, today we're going to look at the cardiovascular system. I know it says circulatory, but really cardiovascular is the term we normally use for this system. It includes a pump, which is the heart, and the pump is going to circulate the blood around in the blood vessels, the arteries, the veins, and then also capillaries, which are the exchange vessels. Then take the blood from the heart to the cells, and they will return blood from the cells back to the heart. Blood carries oxygen, carbon dioxide. Just like you learned with plasma, blood carries waste products and nutrients. The lymphatic system is another system we're going to look at that returns excess fluid from tissues back into general circulation or into the blood. The heart is located in the thoracic cavity. It's located in between the two lungs, so it's medial to the lungs. You can listen to it using a stethoscope, which really you're listening to the flow of blood through the heart and the valves. If the heart stops, all organ systems are affected. We've got to have a continuous blood supply getting there with the oxygen and taking carbon dioxide away. One of the terms you want to know is cardiopulmonary resuscitation, or CPR, where compressions are used to kind of milk blood through the heart, and you're kind of becoming the pump for the person. The blood vessels are arteries, veins, and also capillaries. On this picture you see a heart and the different layers of the wall of the heart. The innermost layer is the endocardium, and then you also see the myocardium, and finally the epicardium, which is the visceral pericardium. There's a pericardial cavity next where there's fluid, and then on the other side of that is a layer of parietal pericardium. The interventricular septum is the septum between the two ventricles. Here we see a heart. You'll notice there are two big veins that carry blood to the heart, and the color of the veins being blue means that the blood is deoxygenated. So here and here, superior vena cava carries blood from the top part of the body, and the inferior vena cava from the bottom part of the body. You also see the largest artery of the body, which is the aorta. The red color means the blood is oxygenated. Just like here, you can see these coronary arteries carrying blood directly to the heart muscle. The pulmonary artery takes blood away from the heart. All arteries carry blood away, but the blood it's carrying is deoxygenated, so pulmonary arteries are blue. Here's a picture of blood flow through the heart. Notice the heart has 4 chambers: the right atrium, left atrium, right ventricle, and left ventricle. Now, as we look at this, notice the atria are receiving chambers, and the ventricles are going to serve as the pumps. Another thing you want to know will be the valves of the heart. So the tricuspid valves are found on the right side of the heart between the right atrium and the right ventricle. The bicuspid or mitral valves are found on the left side of the heart between the left atrium and the left ventricle. 2 other valves you'll see are the pulmonary valves, which are carrying blood into this pulmonary trunk, and then the right and left pulmonary arteries, and then also the aortic valve. These are named for what the blood is going to go into. Aortic because it's going into the aorta, pulmonary because it's going into the pulmonary trunk. And so there's 4 different valves you want to know. And I always remembered right and left here. And you tricuspid before you bicuspid. Tricuspid means there's 3 flaps. They're not showing you all 3 here. And bicuspid means there's only 2 flaps. Tri before you bi. Here's the written information about the valves you'll want to know. And keep in mind that the right side of the heart has deoxygenated blood flowing through it, because blood is coming in from the body. So blood goes from the right atrium through the tricuspid valve into the right ventricle. And when the right ventricle contracts, blood will move through the pulmonary semilunar valve and into the pulmonary arteries. Then blood ends up going to the lungs where it can pick up oxygen. The left side of the heart carries oxygenated blood. This blood comes into the heart through the pulmonary veins from the lungs and into the left atrium. And this oxygenated blood is then going to flow from the left atrium through the bicuspid valve into the left ventricle. And when that left ventricle contracts, it's going to move out of the left ventricle through the aortic semilunar, or just aortic valve, and into the aorta. And then the aorta delivers blood as it branches to the rest of the body. You have to know the flow of blood through the heart. And this is a good picture because it does show you where it's moving. But keep in mind, you want to be able to tell me what chambers, vessels, and also valves. And you're going to have this on one of your assignments, the homework assignment, where you're tracing the flow of blood through the heart. So please learn the parts of the heart, but also you need to know how blood flows through. As we look at heart rate, the resting heart rate is usually between about 72 and 80 beats per minute. And with each beat of the heart, a certain amount of blood is squeezed out as the heart, which is a pump, is moving the blood. And we call that amount of blood that comes out of the ventricle each time it contracts the stroke volume. Stroke volume is about 60 to 80 milliliters of blood. Cardiac output is the total amount of blood ejected from the heart per minute. So that's going to be stroke volume, which is the 60 to 80 depending, times the heart rate. And then you get what's called cardiac output. Cardiac output is about the amount of blood you have in your body flowing through every minute. So about 4,800 milliliters per minute, which is about 5 liters of blood. Exercise increases cardiac output because heart rate is increased, and sleep will usually decrease cardiac output. You don't need as much blood flowing through if you're sleeping. Blood is supplied to the heart muscle itself through the coronary arteries. So you have a right coronary artery and a left coronary artery, and then these branch further. If a person has a myocardial infarction, another term for a heart attack, it's because these coronary arteries or their branches are blocked. Heart sounds are caused by blood flowing past valves. As those valves close, we get the sound. So we use the term lubbed up. Lub is the first sound that's made. It's caused by the closing of the bicuspid and tricuspid valves. This happens when the ventricles contract. Conduction system means the electrical system of the heart. It's going to be what controls how the heart beats. As we look at the heart, we'll see there's different nodes. These are modified muscle cells that are able to spontaneously send a signal. The pacemaker of the heart is found in the right atrium, and it's called the sinoatrial node. It's the first one to send out the signal. Another node is found between the right atrium and the right ventricle. It's called the atrioventricular node. And then if you look, so here's the SA node and the AV node, you'll see what we call the atrioventricular bundle. And the right and left bundle branches, so there's the bundle really, I don't know why it's pointing there, and then there's the bundle branches, and then it comes around to the Purkinje fibers. In order for the heart to beat, this system has to be working properly so that the Purkinje fibers are stimulating the cardiac muscle to contract and pump the blood. As the electrical signal is going through the heart, through that electrical conduction system, we can pick up these signals using an electrocardiogram. And you can see here a P wave, a QRS complex, and a T wave. The P wave represents the depolarization of the atria, where that signal is spreading across the atria. QRS is going to be ventricular depolarization, when the signal is being sent through the ventricle, and that causes the ventricle to contract. And then the T wave is ventricular repolarization. Heart disease is the leading cause of death in both men and women in the U.S. It used to be highest for men, not for women, but now it's true with women as well. Arrhythmia means any change or deviation from normal heart rate. So if a person has a slow heart rate, which means fewer than 60 beats per minute, we call that bradycardia. Tachycardia is an abnormal rapid heart rate higher than 100 beats per minute. This wouldn't be if you're exercising, but usually a person is just still and they have a tachycardia. A heart murmur has to do with a defect in a heart valve. An example of this would be mitral valve prolapse, where the bicuspid or mitral valve, it doesn't close correctly and it prolapses up into the atria, which means it's just not closing off, and so blood flows back into the atria, so it can cause headache and chest pains and anxiety. Coronary artery disease is narrowing of those coronary arteries supplying the heart muscle. And usually it's caused by plaque on the artery walls. We call this atherosclerosis. It's not arteriosclerosis, which is another term that means hardening of the arteries. If an artery becomes completely blocked, a myocardial infarction or heart attack can occur. Angina pectoralis is sometimes a sign that the coronary arteries are becoming blocked. And it can cause severe chest pain that arises when the heart does not have enough oxygen. It occurs suddenly and may be brought on by stress or even physical exertion.